So I have reviewed my patient's chart and for his allergies and his cold status. I gathered my supplies, which is my stethoscope and my pen light. I will be performing hand hygiene and donning gloves on. Hi, how are you? My name is Vilma Callejas. I'll be your student nurse today. May I have your full name and date of birth?
My full name is Daniel De Jesus Hernandez, and my date of birth is 11/10/1993.
Mr. Daniel, today we're going to be performing a full physical assessment on you. It's basically a head-to-toe assessment. I will be touching and feeling, listening to your heart sounds and your lung sounds, to your bowel sounds, but nothing should feel uncomfortable. So at this point, I will provide privacy and comfort for my patient. I will also elevate the height of the bed to a good working position. Okay, Mr. Hernandez, I have reviewed your chart and your vital signs, and they are normal where we want them to be. So your blood pressure is 124/80, your heart rate is 87, and your respiratory rate is 14. Your temperature is 98.2 degrees Fahrenheit, and your O2 saturation is at 100%. These are normal signs. Can you tell me your pain level on a scale from 0 to 10?
It is a 0.
Okay. While I'm doing my pain assessment, I'm looking at verbal and non-verbal signs. Can you tell me your age and your gender?
I am 27 years old and I am a male.
Okay. Can you tell me your height and weight?
I am 5'4" and 155 pounds.
And do you have any allergies?
No.
Okay. Now we're going to continue with the orientation and speech assessment. Mr. Hernandez, can you tell me what time is it right now?
It is 5:30 p.m.
Okay. Can you tell me the date today?
It is October the 7th.
Okay. Can you tell me where you at?
I am at the Betsy Johnson Hospital.
And in what city is the hospital located at?
It is in Dunn, North Carolina.
Okay. And can you tell me why you're here?
I am here for some tests.
Okay. So while doing my orientation and speech assessment, I'm assessing for the content, the relevance, and the organization of my patient's responses. In his speech, I'm assessing for the quantity, the pace, the volume, and the clarity. I can also see that my patient is well groomed and clean and that he has a good posture. So now I'll be assessing the skull for the size, the shape, the symmetry, any masses or scars. I'll also be assessing the hair for thinness, thickness, texture, any oiliness, and evenness of growth. So now we'll be assessing facial movements. So Mr. Daniel, could you raise your eyebrows for me? Can you squeeze your eyes tightly? Could you frown? And can you smile big, showing teeth? Okay. I will also be checking the eyelashes and the eyebrows for hair distribution and alignment. Now we're going to be doing our eye assessment. I will be inspecting the sclera for color, and I will be assessing the pupils for size, shape, and reactivity to light. While I'm assessing my pupils, the size is 3 millimeters, and they are both equal bilaterally. And now I'll be assessing the pupils, making sure that they are reactive to light. I'll be assessing my accommodation. Can you look past the pen? Now can you look at the pen? Okay. And I'll be assessing for my convergence. Can you follow the pen? Okay. So my patient's pupils are parallel, which they are equal, round, and reactive to light and accommodation. So now I'll be assessing for the external nose for any flaring or any discharge. Also, I'll be assessing the nasal cavity, the septum for any swelling, any discharge, or any redness, any growth, and then making sure that the septum of the nose is not deviated. Also, Mr. Daniel, could you put your finger on one of your nostrils and close your mouth and exert air throughout that other nares? Okay, can you do the same one for the other one? Okay. Okay, so now I'll be also inspecting at the ear and the external ear canal for any buildup of cerumen, any lesions and drainage. And Mr. Hernandez, do you have any hearing aids at home?
No.
Okay. So now I'll be assessing my patient's mouth. So first I'm assessing the lips for the skin integrity, the color and dryness. Could you open your mouth for me? I'm also assessing the gums for any bleeding, the color, any edema or any lesions. I'm also assessing the tongue for color and dryness, as well as the teeth for any cavities, the color, any chipping or tooth loss, and if they have dentures, I will be assessing for the presence of the dentures itself and the condition of it. I'm also going to assess the hard and the soft palate, assessing for the shape, the color, and dryness. So now I'll be assessing my patient's trachea, making sure it's midline in position. I'll be assessing my patient's thorax for the breathing pattern, the rate, the rhythm, and the symmetrical rise and fall of the chest when breathing. In continuation to my cardiopulmonary assessment, I will listen to all 4 sides of the heart sounds now. On each side, I will listen for 10 to 20 seconds and making sure I hear S1 and S2. For my mitral or apical pulse, I will be listening for a full minute for count. My aortic, pulmonic, tricuspid, and mitral. Now I'm going to be listening to my patient's lung sounds. I will be listening to the 6 points anteriorly, 8 points posteriorly, and 2 lateral points on each side. Every time I'm listening to each point, I'm listening for a full inspiration and expiration. I will be also comparing findings on each point with the corresponding point of the opposite side of the thorax. Mr. Hernandez, could you step up for me, please? Can you take a slow, deep breath? Again. Could you please turn around? Slow deep breath. turn this way. Raise your arm a little bit. Deep breath. And on the other side. Deep breath. Okay, Mr. Hernandez, your lung sounds are normal. Now I will also be palpating my posterior for any tenderness or masses and any abnormal movement with inhalation and exhalation. Could you turn around? I will also be palpating the anterior for any tenderness or masses. We will continue by assessing my patient's pulses. First, I'll start by assessing his carotid pulse. Can you turn your face that way? I'll be assessing one at a time, making sure to avoid applying too much pressure and massaging the area. +3. +3. Now I'll be assessing his brachial pulse. This one. +2. I'll be assessing his radial pulses simultaneously to determine the symmetry of the pulse volume. +3. Now, could you lay back for me? I'll be assessing his femoral pulse. Okay, could you sit back up? Now I'll be assessing his popliteal pulses. +2. Now I'll be assessing his posterior tibial pulses. And finally, I'll be assessing his pedal pulses simultaneously to determine the symmetry of the pulse volume. +3. So now we'll continue with our peripheral perfusion. I'll be assessing the hands for the temperature, if there's any edema, which is not noted. And if there was any noted, it would be noted as 1 to 4. So this would be a 1. Now we're assessing for the color, any presence of cyanosis, which there is none. Now I'll be assessing for my capillary refill. Less than 2 seconds. I'll also be assessing for my patient's skin turgor by pinching on the skin and noticing if there's any tenting, which there isn't, so my skin turgor assessment will be elastic skin turgor. Same on this side. So I'll also be assessing the feet. The same, looking for any color, any edema, the skin turgor. And my patient has elastic skin turgor. And I will also be assessing for the capillary refill. The temperature and capillary refill is less than 2 seconds as well. We will continue by doing the abdominal assessment. So I'm gonna ask my patient, could you lay back for me? And I will be uncovering your abdominal area. Is that okay? First, I will be inspecting my patient's abdominal area for any scar, any masses, or any distension. Then I will auscultate all 4 quadrants for 10 to 15 seconds. After listening to my patient's bowel sounds, which they are active, I will be palpating all 4 quadrants for any masses, any tenderness, or any muscle guarding. I'll be also palpating the area above the pelvic pubic symphysis for any bladder distension. Okay, you may sit up, Mr. Hernandez. At this point, I would perform my perineal assessment. I would be inspecting the groin and genitalia for skin integrity, discharge and lesions. I would also inspect the rectum for skin integrity, discharge, lesions, and if there's any protrusions. I will also be performing a skin assessment. Throughout my assessment, I will be inspecting for the skin, its color, the integrity, if they have any bruising, any moisture, any scars, any bleeding, wounds, fistulas, and if my patient has an ostomy. I will also be assessing if they have any dressings, and if they have any dressings, I will be assessing for the integrity of those dressings. I will also be assessing my patient's nails, their fingernails and their toenails. I'm assessing for texture and color. Now we're going to continue with the musculoskeletal assessment. I will be inspecting extremities and joints, assessing for any deformities of limbs of the hands and feet. Now could you sit over here looking towards that way? Now I'll be assessing my patient's spinal alignment for any lateral deviations or any abnormal curvature. Can you curve your spine? No. Bend all the way. Okay, normal assessment. Okay, you can sit back up here. Now I'll continue with the assessment of muscle strength. So, Mr. Hernandez, I'm gonna ask you to do a couple of things for me. So I'm gonna put my hand here. Could you press towards it with your neck? Okay. Could you do the same on this side? Okay. Equal strength. Now I'm going to press on your shoulders, and can you shrug your shoulders for me? Okay. Equal strength. Now I'm gonna ask you to squeeze my hands as hard as you can. Okay. Equal strength bilaterally. Now I'll be asking you to sit back, and could you press on my hands like a gas pedal? Okay, equal strength bilaterally. And now could you push your toes towards your nose? Okay, equal strength bilaterally. So, Mr. Hernandez, now we're going to continue with our assessment, and we'll be doing a couple of range of motions. So, I'll be doing a couple of movements, and you can just copy me, okay? So first we're gonna start with our neck. So to the side, the other side, now back, and in front. Okay, so now we're going to go with our arms. So raise, and down, to the side. Okay, now all around. Okay. So now we're going to continue with our elbows. So shoulders like that. Now can you extend, flip, down, and now up. Okay, now can you go outwards and then inwards, and then can you spread your fingers for me? Can you make a fist? Now turn, and with your thumb I want you to touch each one of your fingers. Okay. Okay, so now we're going to be assessing your spine, so can you touch your toes for me? Okay, now back. Okay, now to the side, now to the other side. So now we're going to be doing a couple of hip range of motions. So can you raise up like this? Now back and do a little circular motions. Okay, now to the side, and then now all the way across. Okay, so same with the other one. Up, now back, and little. Okay, now to the side and all the way across. Okay. So now we're going to be doing knee range of motion. So bend your knee. Okay. Now extend. Okay. Same with the other one. Bend your knee. Now extend. Okay. So now with each of our foots, I'm gonna ask you to go like this. So press like a gas pedal. Up. Okay. Now towards the inside and then the outside. Okay. Same with the other one. Press like a gas pedal. Up, inwards, and outwards. Okay, so now with your foot, put it on the ground like this, and can you curl your toes for me? Okay, can you spread your toes? Okay, same with the other one. Curl your toes and spread your toes. Okay, so that finishes our range of motions. Now I would like to ask you if you could take a couple of steps from this side to this side, so I will be assessing your gait. Okay, Mr. Hernandez, I see that your range of motions are equally strong and equally flexible. You're able to do each of them without any problems, and your gait is stable. This completes the full physical assessment. Now I will doff gloves and perform hand hygiene. I will make sure I leave my patient safe and in a comfortable position with the call bell within reach and the height of the bed at the lowest position. Now I will document my assessment data in the patient's record.